Hello, I am an endocrinologist. Why are you here?
Hi. I am here because I am concerned that I may have Cushing's disease.
Ha ha ha. No, you do not have Cushing's disease. What else can I help you with?
Wait, you didn't even look at my labs. You didn't even listen to my symptoms. How do you know that I do not have Cushing's disease?
Cushing's disease is extremely rare, therefore it is literally impossible for you to have it.
Are you sure that you mean literally? It's literally impossible?
Yes. Cushing's disease is so rare that it is pretty much literally impossible for you to have it.
Even if it is a rare disease, at least a few people must have it. Otherwise it wouldn't be a disease. How can you be so sure that I do not have Cushing's?
I'm sorry. I didn't realize that you went to medical school. I also didn't realize that you went through 3 years of residency and 2 years of fellowship. As a fellow endocrinologist and expert, you must remember in medical school they told us that we would most likely never see a case of Cushing's disease in our medical careers. Cushing's disease is extremely rare. You absolutely do not have Cushing's.
I gained almost 100 pounds in less than 8 months.
You need to diet. It is unhealthy to be so overweight.
I am on a diet. I've been on a 1,000 calorie a day diet for months and I just keep gaining weight.
You need to eat less and exercise.
I can no longer exercise because my arms and legs have become so weak. Even getting out of a chair is difficult.
All that extra weight can make you tire more easily.
But Cushing's disease causes muscle weakness and weight gain.
You do not have Cushing's. You just need to lose weight.
I have this fatty hump on the base of my neck. I'm worried it's a buffalo hump.
That is not a buffalo hump. You were just overweight. You gained 100 pounds and all that fat had to go somewhere, right?
I have these thick red stretch marks on my stomach.
Yeah, you single quote LLL get that with a massive weight gain. You need to diet and exercise.
My skin has become so thin. I can't wear band-aids because it tears my skin. I bruise easily and take a long time to heal from minor scratches.
Okay.
Okay? Isn't that a sign of Cushing's?
Not really. Some people have fragile skin. It's just part of getting older.
I'm 32. I also have developed insomnia. Most nights I get less than 3 hours sleep.
Your poor diet and lack of exercise are affecting your sleep cycle. You might also be depressed. Depression can cause insomnia. Would you like some antidepressants?
No, thank you.
I see no need to investigate further. You clearly do not have an endocrine issue. You do need to lose weight, though, because you are obese. You must diet and exercise. Is there anything else I can do for you?
I have a few labs that my primary care doctor ordered that might indicate Cushing's.
Ha ha. Okay, let's have a look.
My 24-hour urine results showed an elevated cortisol level. The normal range is less than 50 and I had 89.
This test just proves my point. You clearly do not have Cushing's.
But my cortisol is high.
It is high because you are obese. This test just proves that you need to lose weight. If you had Cushing's disease, your score would be at least 5 times the upper limit. An 89 is completely meaningless. You need to diet and exercise.
Well, my doctor also did a cortisol blood test. It was 30 at 4 p.m. when the upper limit was just 12.
You expect high cortisol during the day. That doesn't mean anything. A midnight cortisol is the only blood test that would matter.
Funny you should say that. I had a midnight blood draw and my result was high.
Really? What was it?
9.
9? See, you clearly do not have Cushing's.
I thought anything above 7.5 was diagnostic for Cushing's.
Well, that's debatable. Let me ask you this. Did you get in your car and drive to the lab?
Yes, of course.
Frankly, I'm surprised your cortisol wasn't higher. Between driving to the lab and the stress of the needle prick, I'd expect your cortisol to be at least 12 or 15. 9 is pretty low under those circumstances.
Are you just making up these numbers? Where did you get the idea that driving a car would increase your midnight cortisol levels? Why do they say 7.5 is diagnostic for Cushing's if it isn't?
Where did you get this 7.5 number? The internet? Listen. Put Cushing's out of your mind. You do not have Cushing's. You just need to lose weight and stay off the internet. You look sad. Would you like some antidepressants?